Welcome to Yourself at Work with Kristen and Daryl. We're really excited today to present our episode with Dr. Connie Quinn. Connie is a licensed clinical social worker who's been practicing since 1996, the last 7 years dedicated to employee-sponsored healthcare tech clients. She's held faculty appointments at both Adelphi and Columbia University, is a certified sex therapist, and currently is the virtual medical director at a national primary care company after many years of state and federal service. Today, we'll be discussing common mental health challenges of tech workers, including depression, anxiety, and the imposter syndrome that often comes when perfectionists find themselves surrounded by the best and the brightest. Here's our conversation with Connie. Hope you enjoy. Connie Quinn, welcome to Yourself at Work. So nice to have you here. So you and I have known each other for quite some time in a variety.
I was counting earlier. It's like 6 years or so.
Should I say that it I don't know if it feels longer or shorter than but in a variety of contexts. But I think one of the things that we're really excited to talk about is just that you've had such a wide variety of experiences, both in private practice, but also then into corporate wellness. So you and I know each other very well. But for our audience, it would just be great if we could start off with a little bit about just your background overall, and then we'll get into some of the rest.
I'm happy to do so. First of all, thank you both for having me. This is a really wonderful opportunity to talk about something that obviously I'm very passionate about. So I am a licensed clinical social worker. I also have a doctoral degree in social welfare. I've spent 20 years of that clinical practice also as a social work educator at two New York social work universities, Adelphi and Columbia, sort of super Ivy, and a School of the People. So very different experiences in terms of even that part of my career. It's funny when people ask me sort of how I got to be part of this mental health experience. I always tell this story about when I was a kid during the holidays, grew up on Long Island. My parents would take us into Manhattan to see the Christmas windows. And there was a man outside of Saks Fifth Avenue who was selling pencils in a cup with his seeing eye dog. And it was just heartbreaking to me. And I would say to myself, when I grow up, I'm going to come back and I'm going to give him $10. And that was like, little Connie's version of the heart of a social worker. And I didn't know it at the time. And my dad would have loved for me to be a banker. My mother, I'm sure, would have loved for me to be a trophy wife. And, lo and behold, here I am. And I think it's sort of a testament to that moment. And, working in this field is not for the faint of heart. You're constantly holding space. You're constantly sticking your finger in the dike. You're constantly just living in the soup of despair with high highs and low lows. So I would say the first 10 years of my career were spent in juvenile corrections, working for the state of New York. And that was such an eye-opener, especially from a white woman of privilege from Long Island, working with this population. And actually, the universe had my back because I was actually really good at it. I look back and I think, wow, that was pretty badass. Like, how did you do that? And I just, it's like, I was curious. I wanted to know more. Tell me. And I heard and saw the most amazing things. And it was such a privilege to be able to do that work. A lot of humility too. And maybe we can get to some of those experiences in a bit. But so then worked for the state in Albany for a bit, worked in probation for a little bit, and then at a certain point went to the federal system and ran the inpatient psychiatric unit at a VA hospital in Westchester that was a psychiatric hospital. And to be fair, I always tell people every time I made a move, it was really important to me to work with the smartest and the funniest people I could find. And I have continued to do that because you have to have funny if you're going to have devastation. Like the two of them need to sort of hang together. So I wound up becoming the director of an eating disorder treatment facility at the partial hospitalization and intensive outpatient level of care, national organization. And that's where the real trauma informed care education piece came in. So, every time I made a move, I traded up, I learned more and more and more to the point where that sort of clinical experience didn't serve me any longer. And I thought, well, I'm looking for a new home. And I landed in corporate healthcare tech. And I thought, oh, this eating disorder clinic, this is really a hard job. I'm going to go to healthcare tech. That's going to be a day at the beach. I'm going to, that's got to be like, well, that was, sort of eyes wide open. Again, so grateful. And I always say, like, I know more about tech than any social worker ever should. And I think one of the reasons why that environment really resonated with me is because my dad was a fairly prominent savings banker back in the 60s, 70s, 80s, when savings banks became no longer a thing. And I was always really interested in the vertical and horizontal nature of organizations and organizational culture. Actually, that was what my dissertation was about, organizational culture and ethical decision making. So when I was seeing patients and they would share with me things about, organizations, of a healthcare tech nature, I would be fascinated. So not only was I treating the clinical, I was very often having to understand and unravel the infrastructure of what was driving a lot of the mental health issues. So that's sort of been the trajectory. When I started in healthcare tech, I was doing straight clinical work. I took a break from, running things. I am now in a leadership position in the healthcare tech space. And, just in the 7 years that I've been doing what I'm doing, I have seen dramatic changes in service delivery, and supports and resources, third-party vendors that are available to companies, that provide the level of service, the space that I work in, but also the diagnostic acuity and complexity of the patients that we're working with. Certainly before the pandemic, but boy, I'm not a science fiction person, so I never could have invented or, imagined, the pandemic, one, but the level of intensity that has been visited on so many people that are receiving care and have wanted and made themselves available to receiving therapy, coaching, as a result of grief, social isolation, just sort of being lost.
I just quickly wanted to go back to something you said before, because I kind of chuckled at something that probably actually needs a little bit of clarification. So, because it may have come off as a little bit insensitive. When you had said that moving from what you were doing previously into the tech world, and assuming it would essentially be a, I don't know, easy job, cushy job, or something like that, right? Or assuming it would be a lower intensity. And I mean, I chuckle just because like this is something we've discussed extensively and lived a lot, right? Around how it is far from that. And so I just wanted to, one, clarify that it was more, I was not making light of that, but more, I was just wondering if you could talk a little bit about that kind of, that shift and sort of that yeah, I mean, almost you talked about a bunch of things that were really, you worked in a lot of spaces that I think anybody would agree were extremely intense, right? And I think that it's probably, I don't know, maybe to an unfamiliar ear, the idea that and especially obviously in a world that's often full of privilege and things like that, but that the idea that tech is intense, that you could even talk about it in the same arena as some of those things, I think is pretty interesting.
Correct. I mean, population to population to population, it was mind-blowing, the catastrophic anxiety. I have a cut on my leg, therefore I probably have to have my leg amputated. Like, I mean, slight exaggeration, but not too far from it. And I really, I sort of consider myself, if I think about myself as a clinician, and we always get asked this during, well, what's your model of practice? So, I'm very relational, sort of very attachment oriented, but, how do I intervene? Definitely evidence-based practices sprinkled with a little mindfulness, or a lot more mindfulness than I ever thought I would need to, keeping people present. But I had to legit go back to some basic CBT stuff, cognitive behavioral therapy, dialectical behavioral therapy, acceptance and commitment, do really hardcore, very systematic, sequential work with a lot of patients that I was very surprised about. But yeah, I mean, the depth of depression, the depth and the breadth of depression, trauma, I thought, oh, you know what? We're all the same. We're all hurting. We're all supremely flawed. We're all supremely human. And I think it was just sort of, if I could say this without like being canceled, sort of like, you make a lot of money, stop.
Mm.
And sorry, that was just a ridiculous thing. We all have significant challenges, and just because you are fortunate to not have to worry about that piece doesn't change the fact that you were bullied in elementary school, so you stuck your head in your books, that STEM became the God send, the universe send for you, that you got into college, that you were able to, excel, and here you are. But your imposter syndrome, your social isolation, your absence of meaningful relationships, your struggle socially with your TL, okay, fine. So you have some stock. That doesn't mean a damn thing if you don't have anything to do this weekend, and on and on and on. So yes, I mean, smirk, but boy, was I humbled. What I will say, which is very interesting, is that I expected to see more substance abuse substance use disorder, and I did not. It was, I would say, if we're looking at the diagnostic categories, did a lot of adjustment disorder, and I can touch upon that. That is sort of what, my lowest level diagnosis. But generalized anxiety disorder, persistent depression, depressed more days than not, then major depression, single episode, mild, moderate to severe, and then maybe somebody that's really chronically depressed. A lot of historical trauma, a lot of college campus trauma, a lot of college campus sexual trauma, a lot of folks using cannabis. That sounds like so, grown up, using cannabis. A lot of people smoking weed, doing gummies, vaping, all the things, people loving their mushrooms, but never to the point where I felt like this is really interfering with your quality of life. I guess I'm just not that much of a prude, but they're also not drinking as much. So, but really the anxiety, the depression, the adjustment disorder was predominantly reserved for, my observations were, folks sort of new to an organization, they come in all bright and shiny and like, oh, okay, well, I've been here 6 months now and I still don't really know anyone and I don't have anything to do and I don't have anywhere to go. And I can't now, many of them couldn't even get home during the pandemic. But, so sort of across the board.
Yeah, I want to go back to what you were saying about the kind of things that you're seeing in the corporate environment. And you touched about, this podcast, we focus on like mental health and well-being in the context of the workplace, which can either be like a technology company, a large organization. And as you were talking about that, you kind of touched on two components. So one was this sense of shared humanity, and we're all complicated, flawed human beings, and having a big paycheck doesn't change that. So just the sense of like, we're all human. But then you were also touching on like the ways in which it's just a different set of individual characteristics or environmental circumstances for people in the tech industry. Like you mentioned, someone that was bullied as a kid and then addressed that by studying, and then they end up in tech, but they're still struggling with this early social isolation. I'm curious to talk a little bit more about that second one. Like, what are the categories of things that you're seeing uniquely in the tech world? And I'd love any thoughts on like, what is driving that? Like, is it driven by the environment, like the environment that people are in today, like by the company that they're working in and the pressures and so forth? Or is it more of like a selection bias, like the kind of people who ends up in these jobs tend to have XYZ history? Like, I'd love any kind of observations around why this would be different.
Yeah, and just sort of as I sort of move forward with this, these are observations. This was one social worker's experience. I mean, I think it's very much a common experience of, at least, conversations I've had with colleagues sort of around this, but these are, really observations. And I imagine, that kid that I sort of describe then becomes the salutatorian or the valedictorian or, sort of high achieving, because that is where, the validation is going to come from. It's sort of this external environment sort of propping them up to do the next thing. And then they sort of go and they wind up in this environment that has all of the valedictorians and all of the salutatorians, and all of the, everything, all the mock UN, kids and all of that. So there's that. The other thing, and again, observation, that I always thought, wow, what a great job for an introvert, right? It's like me and those lines of code. Let me go in and clean up the code base. It's like, like I don't have to, again, sweeping generalization, but I don't really have to do that much interface because this isn't going to talk back. And for the highly sensitive, potentially overstimulated, I'm going to throw this out there again. I try to stay away from a lot of jargon, but the neurodivergent, even, it's a great bet. But that's just sort of one space. Then there's all of the other parts of the infrastructure that keep these companies going, whether it's sales or HR, recruiting. But again, that you may have many more extroverts in those spaces, but you're still getting that best and brightest type. And then all they talk about is imposter syndrome, which it's funny. I probably was asked if I knew what that was maybe 25 times in my first few months. Do you know what? Have you ever heard of imposter syndrome? And I'm like, yes, but tell me more. Yeah.
That's so interesting. Yeah. So it sounds like from the observations, it's potentially less about the culture that's like the kind of environment in the job today, and it's more about all of the history of the kinds of people who end up in that type of job. Is the sense?
Well, I would be remiss if I didn't say I think that the environments don't always help. The way that people are, performance evaluations, the intensity of all of these things that are more hurdles for folks to jump through tend to just exacerbate the inherent nature of the person that winds up in the environment itself. So those sort of things sort of feed off each other, and it's a little bit of a quiet storm.
Like if you have someone listening to this podcast who's in tech, who has imposter syndrome, who's feeling anxious, like what are a handful of things you would just want people to know that someone should have told them much, much earlier in their careers or lives?
Oh my goodness. I mean, I just love it's okay to not be okay. It's as maybe overused and cliche as it is now. It's kind of okay. I mean, I've just been through a major life transition as I, record this podcast from my son's basement, waiting for my new apartment to be ready. And I've had some not okay days. And that's okay because I have that afternoon and I have tomorrow and I have all of these other moments where I can decide, all right, I'm over myself, so I'm going to keep it moving. Specifically with some of the things that I have heard, over time, I would always say in session, okay, so what data points do you have to support that's grounded in any sort of scientific evidence? One of the things sort of working in this space is sort of, I would say, okay, what are the data points? Let's do a data dump. If you would write your own line of code, what would it be? So sort of using that language if they couldn't quite grasp on. But I think just more sort of a broad stroke of psychoeducation is, absolutely it's okay to not be okay. There's lots of resources out there that um, really can speak to that one thing that you need to hear. Assess who's around you. Let go of the things that don't serve you anymore. Is this thing I'm about to do good for me or not so good for me? And not every day is going to be an A++. Not every day. You're not going to be the valedictorian every day of your life. So if you can just be good enough. When I do CBT, I will say to folks, and the sort of the we want to let go of limiting core beliefs and change automatic negative thoughts to something a little bit more positive. So, I'll say, look, if you wake up every day and say, oh God, this is a terrible day. It's already a terrible day. I can tell. That sounds terrible. I'm not going to say, oh no, it's going to be an amazing day. I just want them to say, it's okay. Like you'll never be that person skipping down the hall saying, woohoo, I get to, do X, Y, and Z. It's like, how about it's okay. It's just okay. So sort of just sort of, sometimes it's just okay. Oh.
Yeah, I love that. And I know in my own journey, I was the high school valedictorian along with probably the rest of Google. And I think one of the things I've learned
I was not.
through my
I was not. I was the scrappy B+.
One of the things I've had to learn is that like that kind of level of perfectionism is very much a way of avoiding pain, right? Like it's like if I always get the answer right, then I never have to feel the pain of having been wrong or failed or whatever. And so an ongoing huge part of my own like emotional, mental growth has been exactly what you just said, that like nothing's broken if you're sad or disappointed or angry or whatever, traditionally negative emotion. It doesn't mean something's broken. It just means you're a person, and like really becoming more comfortable with those emotions and not seeing them as a sign that something is broken I think is a really powerful point you're making.
Right. And, another really wonderful thing to keep in mind is, nothing is permanent. It's all just fleeting. It's all, and, I think that's really where the mindfulness, the sprinkled with mindfulness piece comes in, is, if you can just stay present. Anxiety has not been known to cause the demise of anyone that I've ever worked with. I'm trying to use gentle language. It usually passes in about 120 seconds if you can just stay present. And it's we get caught up in that rebound effect of, oh, but what? Oh, but that. It's like, and you're flashing forward, you're looking back rather than sort of saying, oh, right now. And that was a huge, huge feature in when I was working in eating disorders around food, was, folks would give a piece of French toast so much power, when if you really just sort of can ground and, sort of stay in the moment with it, it's just a piece of bread with some syrup on it. But, oh, but then, it's going to go right to my hips, or, oh, and, when that person made fun of me, and it's like, it's a piece of bread. So, I, sort of, that's where the mindfulness psychoeducation can be really, really helpful. Just sit with your feelings. They're not going to hurt you.
So we had this sort of evolution of how we think about, not only talking about mental health in society, but talking about mental health in the workplace and things like that. And we had this sort of big arc around over the last probably say 15 years around sort of taboo into significant investment, shine a light on it, that sort of thing, especially in the tech world. I'm not sure about as much about other industries. And now I think, I don't know, I see little hints of, I don't want to necessarily say pullback as much, but I think that there was a huge focus, obviously during the pandemic, where everybody was struggling and there was a lot of corporate investment. And I think that there's kind of now maybe a fork in the road that I think some organizations are struggling with, companies are struggling with, right? Where it's like, that's perhaps an expensive benefit. It's how many, whether it's mental health clinicians or even coaches or things like that, like how much are we investing in this? Then I think that there's kind of there's a thought of, okay, well, we still care. It's important to our employees. It's important for the well-being of the organization, but kind of maybe what's the bare minimum that we can get away with or whatever. Like, I think a lot of these kind of conversations are happening. I'm wondering what you think about, where do you draw the line between corporate responsibility and then sort of, it's corporate responsibility, perhaps then, I don't want to say clinician responsibility, but something in there, and then sort of personal responsibility. I think we can take that in many, many directions, but I think I'm really just curious about, say that you're making these decisions in a big company, like, we ought to really be doing at least X. And actually, if we do Y on top of that, it's really, really good, blah, blah, blah. Because I think, and I've mentioned this in other episodes about different things, but like, I think it's gotten really easy to figure out how much good programs cost. I don't think we're necessarily as good at saying how much value do we get for the dollars that we spend, because it becomes very kind of, it's a softer thing to measure, or it's just really difficult to measure. So anyway, anything on that?
Yeah. I think one of the most important things is that these types of initiatives, whatever it is that employers put in place, are not reactive to an event per se. Now, obviously, if something happens, employers want to let their employees know, we care, we hear you, we see you. But, this sort of ad hoc thing doesn't provide a really sound infrastructure for honoring the fact that our mental health is of a, Daryl, you and I talked about this, is of a public health crisis. I have this really great slide that is just 5 little kids, like 6-year-olds, sitting all together on the grass. And 1 in 5 as an adult will have a diagnosable mental health condition. And it's just very, very powerful. 20% of the population has a diagnosable mental health concern. It is, a portion of that obviously has serious and persistent mental health issues. So we know this. The Center for Disease Control, the National Alliance of the Mentally Ill, the National Institute for Mental Health, the National Institute of Health, all have data that says nationally, globally, this is what is happening. I highly advise a book, and I will get to your question, Noonday Demons by Andrew Solomon. It's now in a 20th or 25th anniversary edition. It was and I had already been a social worker for a bunch of years, working in corrections, and wasn't really dealing with like hardcore clinical stuff. Andrew Solomon admittedly suffers from depression or struggles with depression. And he gets a grant and he goes around the world and he experiences depression treatments while he writes these beautiful standalone chapters. So anyone that wants to know the state of affairs, should read that book with regard to depression. I think it's just it's a must read. That said, we know this. We have the data at our fingertips. We have the PowerPoints. So employers should, you cannot ask, hey, are you one of those 20%? We need to build that in as if, because the data says that is a thing. So how do you support these people that will come in with mental health concerns in a workplace that is not allowed to discriminate against these mental health concerns? So again, I'm just one social worker out there screaming from the rooftops for the last almost 30 years. But like, it's an overhaul. It's a corporate overhaul. I have seen organizations do what I thought was actually a really great job. I've had the privilege of being on panels where people receiving treatment spoke to other people, openly about their struggles, moderated by, somebody who openly speaks about their mental health issues in the workplace. I had tears in my eyes when I got to be the expert on that panel, because that does not happen. And, sort of, it was like a hallelujah moment for me. But I do feel like you have the data that says, okay, we have this floating around. There are these people that will come to work for us. What might they need? I mean, I think that's a larger question, that if you honor that, then you get to build this. The other thing is,
wait, so really quick, are you saying that actually are you saying that it's less about, like, let's say I'm CEO of blah, 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 and I say, hey, tell me what I ought to do. Are you saying actually it's not about, here, put these 3 programs in place or hire these 3 companies or whatever? Are you saying it's actually about, you need to accept that you've got the 1 in 5 that are going to come in, honor that, believe it? That's, once you do that,
once you do,
kind of writes itself, or?
Well, the story has not yet been written. So, but I'm saying, if once you honor that, the numbers don't lie.
Yeah.
Like, I think no matter where you sit in a continuum, those numbers don't lie. Then you can start to build out. Because I think, I'm not saying what has come or what is in place now isn't working. What I'm saying is, you get to get better at what folks are already doing. I think some people are doing a much better job than others. I've been super privileged to see it up close and personal. I feel like, psychological first aid, peer-to-peer, wellness centers, guest speakers, talks, all of those things that I've seen be super inclusive. But there has to be some connection between, we're doing these things because we know this exists, and how do we start to normalize it?
So a lot of what you mentioned just now was around, reducing the stigma and having conversations and having the resources available, having, providing for mental health support, which I think those are in the vein of like helping each individual work through their own internal mental health. Do you think there's also things that are needed from the lens of the company, like how the actual work is done at the company?
Yes. I feel, what I think is really unique, and Daryl, you and I have talked about this, is that tech as a thing sort of just landed, in the last 20 years, sort of grew into its pause just by virtue of time, but sort of reached, how do I say this? Like, my observation sort of looking in was that there was a lot of ad hoc, and we're going to do this and we're going to do this and we're going to do this. And then you've got these elaborate performance evaluations that any provider that might sit with, a patient would see the level of stress. And just when they decompressed, it rolled around again. And, sort of shame about not wanting to be a manager if you're an individual contributor, and like so many different things that I feel like sort of just tech in general didn't have an opportunity to step back and say, hey, we should figure out if this is actually working for people.
I mean, you've talked about this before. I think that what's come up a couple of times in the conversation is the examples that you use are, you use those examples even with the small N count because it's so prevalent even in the small N count, right? When you talk about perf, things like, perf in big tech are these like, they feel like these make or break kind of moments, and it keeps rolling. Yeah. Right. And I don't think anybody, when these companies were started, was like, let's create a process that 150,000 people are like intensely either terrified of or think their whole life rides on it. And we're going to do that over and over forever. No one intended to build the process that way. But by the time the process was then built and implemented, now you have this consequence that's coming out the other end of it. And it's so entrenched, right? And whether it's things like that, manager culture, as you mentioned, all of these things. Yeah.
Yeah. And it was always very interesting to me. So sort of what, the salve or the antidote for that would be making sure, again, observation, making sure all the frozen yogurt machines were working so that people could sort of soothe themselves, or what are we going to put in the micro kitchens, what are we going to do as a perk because we're doing this other thing. How about let's just look at this other thing and find something that's a little bit more, like there was this like parallel process of user experience, putting green, scooter, frozen yogurt. April, October, people are losing their minds with perf and sobbing in the bathroom because it's just, unsustainable. There's a show on Netflix, which I highly recommend, called something about the Blue Zone. Mm-hmm. And it's, how do people live longer and well? And they talk about, one of the predominant psychosocial variables being community and connection and feeling, they were in Okinawa, and there was this woman playing cornhole with her grandchildren at 101. And it is about this, this coming together and having people to talk to and having shared experiences. And I think that, certainly with some of, my experience with new employees feeling lost, moving to a new city, not knowing anyone, making sure, I think that is as important as, honoring Mental Health Day for somebody, I'm not going to take PTO. I'm taking this as a mental health. I'm going to take it as one of my 3 mental health days that come out of my bucket of days off. We get bereavement days. We should be getting mental health days. And we should be able to say those things. This has been so touching. Thank you so much for allowing me to be part of that. I do want to plug, it is Suicide Awareness Prevention Month. And if you know someone or love someone who is struggling, 988 is available to call. and 911, go to your local emergency room.
So Connie, thank you so much for the conversation. I really enjoyed talking with you and learning from you. If people listening want to reach out or learn more about your work, where can they find you?
I am easily found on LinkedIn. That's probably the most efficient place to reach out, and happy to hear from anyone that wants to connect.
Thank you so much.
Thank you.
Thank you. This is great.